I want to start by sharing a short anecdote from my guest. When I was 16 years old, our summer vacation was a trip to Taiwan to visit my mom's family. On the morning after we arrived, we had just finished eating breakfast and were in my aunt's living room. My mom was sitting on the coffee table facing her mom and telling her, "I'm your daughter from the United States." My grandmother looked at my mom, studying her face, and then, after about 30 seconds, she asked, "You're from the United States?" My mom nodded yes. And my grandmother continued, "I have a daughter who lives in the United States." It was heartbreaking. I was told Grandma had Alzheimer's disease. That's from Amy Lang, my guest this week on Optimal Aging, the show for fitness, health, and well-being professionals who want to grow their businesses with more people over 50. Amy is the former gym owner, podcast host, and author, and now a brain health coach with a mission inspired by her family history. And the question behind her mission is one we can all relate to: our genes' destiny. On the subject of Alzheimer's disease, is there anything we can do to protect ourselves? It's a hot question these days. Lots of research on brain health that seems clear that, yes, there's a lot we can do in our lifestyle behaviors that affect our risk of developing Alzheimer's disease or other forms of dementia. And this is all moving into the fitness industry as well. In fact, there's a new franchise, Marble's Brain Body Fitness, that opened its first location recently in Indiana. Now, last year on the show, I had Dr. Cody Sipe of Marble's Brain Body Fitness on the show, and it's a topic that I'll be returning to again and again. I'm sure it's that compelling, it's that fascinating, and it's that important. And I'm sure you'll agree after listening to Amy share her story and her expertise. Hi, Amy. Thanks for joining me again. I'm so happy that you're here.
I'm happy to be here.
Yeah, you've been on the show a couple of times, and do you know you are among the most downloaded episodes of my podcast for the last 5 years have been the two that you were on.
Wow, that's amazing.
You have fans among my audience, Amy Lang, and so
Well, this is the third time and
Yeah.
5 my lucky number. So
Yeah,
let's plan on blowing away the other two.
we're gonna blow them all away, Amy. That's what we're here to do today. Now, joking aside, we're here to talk about a very serious topic, but one that is not as hopeless as we have generally been led to believe, and that's Alzheimer's disease. And you have a new venture regarding that, and I want you to tell us about that. But before you do, I want you to tell us about what happened within your own family last year, but even in the few years before that, that made you devote your time to this.
So back in 2016, my mom was diagnosed with Alzheimer's. I turned 50 that year. That was not the birthday present I wanted. So my mom is still alive today. She is 86 years old, still knows who I am. I'm very grateful for that. But I remember in the beginning, every time my mom sees me, so she lived back in Michigan at that point, right? When I'm back in 2016, every time she saw me, she would say, "I hope I didn't give this to you." And I would say, "I hope so too." It was the lamest answer in terms of like, I didn't want my mom to be worried about that, and she still says that now. But these days, when she says, "I hope I didn't give this to you," I can actually say, "Don't worry, Mom, you didn't." And that is such a gift to be able to do that. And what I'm wanting to share with folks now is really what I learned, what I discovered, so that with the same confidence and conviction that I have, that Alzheimer's can be prevented, that cognitive decline, doesn't have to be a normal part of aging, that we can really age well. Yeah, so last year, my dad broke his hip, and we were all helping my mom at that point, and my dad, and I remember she said, "I hope I didn't give this to you." And it to be able to say, don't worry, Mom, you didn't. It's a relief at one level, right? And it's just so empowering.
So let's be clear about what you're talking about when you say, don't worry, Mom, you didn't give me this. You don't mean that you found a vaccine or that your doctor did some fancy genetic
therapy.
therapy on you. Tell people what you mean when you say, don't worry, Mom, you didn't give this to me.
So it turns out, like, is Alzheimer's hereditary? The answer is yes, right? Like all Alzheimer's in every case has some genetic component to it. But it turns out that the earlier the onset, the more it's about genes, right? As in like deterministic. So early onset Alzheimer's, someone is showing symptoms in their 40s and 50s. Okay. And when you look at what's going on, there's actually 3 genes that cause that. Late onset Alzheimer's, you're seeing symptoms after the age of usually 65. My mom again was diagnosed when in 2016 she was 78 years old. The later the onset, it's more lifestyle and environment that are playing a factor. So maybe you've heard of epigenetics, right? Where it's like your genes load the gun, but lifestyle pulls the trigger.
Yeah.
So you may have a predisposition, but lifestyle ultimately is the biggest determinant of the outcome.
Right.
Right? So in other words, we have agency. You have agency.
Mm-hmm.
Right? You have the ability to make choices and decisions that influence, that can change the trajectory.
Mm-hmm.
So what I learned is by optimizing your brain health, right? You have the ability to, if not delay the onset, prevent the disease altogether.
Got it. So that's pretty radical thinking for a lot of people because you and I are about the same age and we were taught growing up as people were that if you there's nothing you can do to prevent yourself from developing Alzheimer's or some other dementia. If it happens, sorry, there you are, right?
Yeah.
And I think that that's still mostly what people think about it. But I think in the last few years, we're getting more research on brain health and Alzheimer's and related ailments, and we're learning that that's not necessarily a case. But it's not. It's the message isn't getting out there. I don't think. I don't think people see the relation between, eating right and getting good rest and avoiding bad habits and adopting good ones. I don't think that they see how that can later determine whether or not they suffer Alzheimer's. Is that correct?
Yeah, I think so. I actually just did a free masterclass where I broke down the science behind it as to how all of that works. So I'd say one of the things with prevention, if we're talking prevention, so I say 1, you have agency, and 2, early is everything. So we're not just talking, like, obviously you could get genetic testing done to find out if you have any of the genes that make you more susceptible, right? So there's like ApoE4. So ApoE4 is the variant that is associated with a higher risk of developing Alzheimer's. There was a mini series called Limitless on National Geographic that starred Chris Helmsworth of Avengers fame, and Peter Attia, who's like the longevity doc. He was on that as well, right? And so Chris Helmsworth got genetic testing as a result of being on the show, all about longevity, only to find out that he is a carrier of not 1, but 2 copies of ApoE4. So what that means is if you have like 1 copy, I believe your chances of developing Alzheimer's is something like 20 to 30%, something like that. 20 to 40%. If you have 2 copies, it goes up to like 55%. Some estimates put it as high as like 70 or 80%. So it depends on what research study you're looking at. But you're still talking about like a 50-50 chance of developing Alzheimer's, which is hard news to hear.
Yeah.
And even Peter Attia was saying, but when you look at that statistic, that means, though, that there's still 50% who are carriers who don't develop Alzheimer's. And again, I go back to genes are not your destiny. Lifestyle is the biggest determinant of the outcome. Unless you're talking about like early onset Alzheimer's, right? That's much more deterministic. That's a different thing. So early is everything. When I say that, I'm talking about if you look at the progression of the disease, we have the ability now to brain imaging, to actually like PET scans that actually see amyloid plaques, which are one of the hallmark signs of Alzheimer's, along with tau tangles, right? Those are the two that if you've done any research, you've probably heard about. There's a third thing, which is inflammation in the brain, neural inflammation. And when that activates, this is the difference between a brush fire and a wildfire.
Mm-hmm.
In terms of what's happening in your brain, right? So the damage is spreading in sort of an uncontrolled fashion when you're talking about a wildfire. If you want to prevent it, you need to catch it when it's still just a brush fire, right? Or if you notice like there's kindling. I think in terms of Dr. Rudy Tanzi, who is the founder of the Alzheimer's Genome Project. He's also a professor of neurology at Harvard. And he talks about how when you look at the disease progression, we're talking 10 to 30 years before symptoms appear, right? So he likens amyloid to a match and tau to a brush fire. And he says, what if we were looking at amyloid like cholesterol, where if we could have medication that could lower your amyloid load, just like we're not waiting until someone has a heart attack, right? Or congestive heart failure. Like we don't want to wait until you're symptomatic. We want to catch it early on. So if you had diabetes, right? We catch it when you have elevated glucose levels, not when you're starting to go blind. That just wouldn't do that. With cancer, we don't wait until you have symptoms. If you go get a colonoscopy and they find a polyp, they remove it, right? So this is, when I say early is everything, I'm saying if you pay attention to what's going on with Alzheimer's research right now, up until this point, we have only been diagnosing people after symptoms appear. And I think a lot of people avoid the diagnosis because if you believe there's nothing you can do, there's a stigma associated with it, right? So if you're listening to this or you're watching this, I would say the earlier you act, the better. Like even early diagnosis right now gives you more options for treatment.
Okay, I want to ask a couple of questions. When you say prevent, you don't mean 100% certainty that you will not get Alzheimer's disease if you do these things. You mean greatly reducing your risk, correct?
So right now, I would say I would hedge my bet and say, yeah, you're greatly reducing your risk. There are like the Lancet Commission report put out a list of 14 modifiable risk factors. They're being very conservative, right? They look at a lot of research to then say, yes, there's like this preponderance of evidence. And with those 14 modifiable risk factors, they're saying if you address them, you reduce your risk by this much. Okay. So between the first time they put out that report, I think it was 2017, and last July in 2024, the percentage went from, I want to say it was 30 something to 45%. So every few years, they're finding more and more modifiable risk factors, where if you address them, like hearing loss is one of the modifiable risk factors. If you're experiencing hearing loss, you're not able to follow conversations, you can't hear them, you might have a little too much pride to say like, or you just don't want to be annoying, right? Like, can you repeat that? But you're not able to follow conversations. So your brain isn't getting the stimulation. Like vision loss is in that same bucket. So if you're experiencing hearing loss, like go get your hearing checked. And, even if you don't like wearing hearing aids, understand you're helping your brain stay active. So when I say preventing cognitive decline, I think it would depend literally on how action-oriented someone is, how diligent they're being about taking care of their brain health. Because I would say, if you have a healthy brain, you don't have Alzheimer's. Right?
Sure.
So if you keep your brain healthy, now, when you look at the progression of the disease, like if you can keep that amyloid level lower, like I use cholesterol as the example, right? The metaphor. If you can keep your amyloid beta levels lower, that definitely makes a big difference. Because whether amyloid is the match or amyloid is the kindling, it depends on, there's not agreement on exactly what causes Alzheimer's. Okay, they know that amyloid is a player. They know that tau is a player. They know that inflammation is a player. And when inflammation kicks in, that's when all hell breaks loose, right? So, but if you can keep that amyloid level low, and so one of the things that helps with clearing amyloid is sleep, deep sleep specifically. So whether you're looking at nutrition or exercise to help with deep sleep, especially early on, right? I said early is everything.
Mhm.
If you look at the charts, amyloid is accumulating, like it gets to it. It's naturally occurring. That's how cholesterol is such a lovely metaphor for it. Because you're supposed to have cholesterol in your body. You're supposed to have amyloid in your body. You're just not supposed to have it elevated. And when you get a good amount of deep sleep, okay, NREM stage 4, that's when your brain really is, it's like the primary time for your brain to clear that amyloid.
Okay.
Okay. So sleep happens to be one of the 8 protective lifestyle factors for
Okay.
preventing cognitive decline.
You mentioned getting diagnosed early. How do you get diagnosed early for Alzheimer's before symptoms show up?
So they actually have blood tests now. I can't remember the name of the company. They've come up with blood tests that can actually detect their blood biomarkers for amyloid beta as well as phosphorylated tau. So that would be then not waiting for symptoms, right?
Okay, and those a result from those blood tests would reveal indicators.
They're indicators. So I believe that it's 90% accurate compared to brain imaging. So they could do PET scans too,
Yeah.
right? And I believe, so they're measuring blood biomarkers for amyloid, for tau, I believe for inflammation as well. They can detect all 3 now.
Okay.
But they're not FDA approved for the diagnosis of Alzheimer's yet. So you need to pay out of pocket until you're symptomatic.
Of course, we wouldn't want to help anyone before they get sick, would we? That would be silly.
Well,
Okay.
this the whole insurance companies, right? Like if it's not considered actionable without a pill or procedure, then yeah, it's not covered.
Okay.
But lifestyle interventions are actionable.
Hey, are you a fitness professional trying to grow your business with people over 50? If you are, then you need to know how to communicate with them, how to market to them, and how to get them to trust you with their fitness, well-being, and money. We're talking about millions of people who are a little older than the typical market that the fitness industry usually pursues. They have more money, more time, and better motivation to make the best long-term fitness consumers you'll find anywhere. If you're not focusing on them, you should be. PrimeFitit Content is the only content marketing company designed specifically to help you engage people in this group and to help you distinguish yourself from competitors in your community. It's effective, affordable, and super easy to use. Check it out at primefitcontent.com. That's prime, like prime of your life, fitcontent.com. Back to the show. Right. And I want to get to those behaviors in a minute, but before I do so, this test determines if I have these indicators, and then my behavior will determine whether those indicators lead to progression of Alzheimer's. Is that what you're saying?
So by the time these blood biomarker tests, they are detecting those hallmark signs of Alzheimer's. Okay. So it would be like for cancer, I talked about polyps, or, if you go to the dermatologist,
Yeah.
see some abnormal cells. I would say that's like stage 0 for cancer, right? Stage 1, you have a local tumor. Stage 2, it's spread to your lymph nodes.
Right.
Stage 3, nearby organs. I think right now, when you get a clinical diagnosis, meaning you have symptoms of Alzheimer's, that's the equivalent of stage 3 cancer.
Okay.
So stage 2 cancer might be what you're detecting through those blood biomarker tests. So the equivalent of stage. So it's still, the disease has already kicked in. It's just you're catching it early before the symptoms appear, which means if you can slow down the progression, you're still potentially delaying the onset of the symptoms, the impairment. Does that make sense?
It does. And the reason I keep harping on this is because the word prevention can be heard to mean absolute. If I do this, I will not get Alzheimer's disease. And I don't think we can say that, can we?
I think if you catch it early enough, we could. I actually do. I mean, if you look at the progression of this disease, 10 to 30 years, if folks were doing stuff, and mind you, it also does depend on your genetics, right?
Sure, exactly.
So there's, when I say early as everything, I'm looking at things like the prediction side of it. If you got genetic testing, you might understand how diligent you need to be. If you're prioritizing sleep and exercise and eating well and all that stuff, then you're doing a lot to prevent those risk factors from developing as well. And they keep finding more and more risk factors. That list continues to grow. So
it just came out. There was just the new report about it within a couple weeks ago that the number's at 17, right?
I mean, they've found, in addition to the 14 that's in the Lancet Commission report, they have now found the disease, the bacteria from gum disease, periodontal issues. So poor dental hygiene. They're finding that bacteria in the brains of Alzheimer's patients. So it's creating it's an infection. It's creating inflammation.
Okay.
Herpes simplex virus 1, the one that creates those cold sores, also associated now with Alzheimer's, research has shown. So every few months, I'm seeing what they're calling novel risk factors, new ones that they've identified. So that list is going to keep growing. So if you have infections in your body and you're creating systemic inflammation, like the brain doesn't work in isolation to the body.
Right.
Yes, we have a blood-brain barrier, but there's still stuff that can cross that barrier, right? So yeah, I say prevention. Yeah, I'm not going to say 100%, but certainly we can delay the onset, if not prevent it.
Yes.
Altogether.
Okay. So that's what I'm getting at. Again, maybe I'm being too nitpicky about it. I just want to be crystal clear what we're saying. And what we're saying is there's a lot of stuff you can do to lower your risk of getting Alzheimer's disease. Yeah?
Yes.
Okay.
Absolutely.
Give us, when we talk about what kind of behaviors we're talking about, give me 2 or 3. What are we talking about here? Do I have to go run a marathon every year or just brush my teeth every day? What are we talking about?
So the restored protocol that I have actually has 8 protective factors. You can actually go to my website and download the restored protocol.
Yeah.
And it goes through and it actually gives you like some of the science behind it. And it's not just what the protective factor is, but actually the daily habits and practices that would go along with them. So I don't want, it would be a disservice to give you all 8 and then overwhelm people. But clearly one of them is getting enough restorative sleep. The E in restored would be eating nutrient-dense foods. And so I always point people to like the MIND diet. Okay. The S would be staying hydrated. So we want half your body weight in ounces of water. So your brain, understand, like it's made up of, say it's like 70% water, 80% water, something like that. So even being slightly dehydrated, 2 to 4%, actually affects your cognitive function. I know, like, my mom is chronically dehydrated. We can't get her to drink more water at this point. And my dad, too, for that matter.
Yeah. That's a good sign of what we're talking about here. We're not talking about extraordinary crazy woo-woo newfangled stuff. We're talking about taking care of yourself, getting enough good sleep, eating good nutrient dense food, drinking enough water, the same stuff that we hear and repeat about all kinds of health measures that we can take, right? We're not talking about crazy stuff regarding brain health. Yeah. Okay. So tell me, you've got obviously a very compelling personal story to cause you to take this on as your new work focus. And it's a very common anxiety or fear that we all have, particularly people our age, because we might still be caring for a parent as you are. And women who have gone through menopause might be aware of some of the risk associated there. Give us a little bit of information about how this is different between men and women, particularly because of menopause.
So women outnumber men 2-1 when it comes to Alzheimer's, right? So the number of people living with Alzheimer's right now is estimated to be 7 million here in the US. So 2-1. And more research now is being done, menopause, perimenopause.
Mm-hmm.
And what they've actually found is a connection between menopause and Alzheimer's. And it has a lot to do with the loss of estrogen and its protective effects. So women's brains age differently from men, right? As men age, your testosterone levels decrease gradually over time. For women, just like testosterone for men, estrogen is not just a sex hormone, right? It affects a lot of things in our body. It is actually a master regulator in our brain. And during perimenopause, it's chaotic, right? Our estrogen levels are all over the place. And then with menopause, it goes to almost zero. So women's brains age differently. So when you look at, I talked about that list of modifiable risk factors, obesity, high blood pressure, depression, type 2 diabetes, chronic inflammation, poor sleep. Menopause and that loss of estrogen contributes to those. So, I don't know how many women who have hot flashes and night sweats also have sleep disturbances as a result of that, right? Or their insulin resistance level goes up. So type 2 diabetes kicks in. There's that. Weight gain in their midsection, right? More visceral fat contribute, right? So that modifiable risk factor stuff kicks in for women. If you've ever had frozen shoulder, that's inflammation in your body. So yes, I think when we talk about timing, when I say early is everything, for women, this period, perimenopause, postmenopause, if we take action now, we're either helping to prevent or delay the onset of the disease.
Okay. Now, Amy, you've had several phases in your career, even before you got into fitness, but even in fitness, you've had a few. And so tell us about this new one. What are you doing for folks to help them with these issues?
I thought about, what do I actually want to be known for, right? When you think about your legacy, and if I could help people not have to worry about cognitive decline, right? If I could really help to prevent Alzheimer's, that's what I want to be known for. And I do believe that for women, menopause, again, is that window that we have. I want to change the narrative too around menopause. I'm hearing it, there's a lot being talked about. This is no longer your mom's menopause. We're talking about it now. We're finding out that there's a lot we can do in addition to, say, hormone replacement therapy, right? And just to be fully transparent, I am on hormone replacement therapy. So I'm not against it, but I'm trying to do everything I can to support my brain and my body as well. So the narrative, though, has been almost turned into menopause being like a medical condition, right? In traditional Chinese medicine, menopause is actually referred to as 第二春, which means second spring. I want women to see it as new possibilities, as a new beginning, as, if you're no longer having to spend all your time and energy taking care of other people, and you can spend some of that exploring within, tapping into your own inner wisdom, and really being able to reclaim a lot, right? Reclaim your clarity, your confidence. I talk about power, like you have agency again. Then it's about how we get to grow and develop, and right, second spring, we get to blossom as opposed to decline. Menopause is the beginning of the end. I think that's right. That's how it's being. Mark Middleton talks about growing bolder. It's that same sort of, there's all this messaging. How do we change the narrative for ourselves? Where do you believe that menopause is the beginning of the end for you? Or is it your second spring?
Right.
And how much more power do you have, right? The ability to live fully. So, yes, I care about preventing cognitive decline, but I can't control that outcome. What I can do is focus on what I do today in the present, because tomorrow's not promised either, right? So we gotta focus on what we do today. And so when I do health coaching, it's always about you know what to do. Are you doing it? Those 8 protective factors. When I talk about, you now know what to do. And I do want to break it down into habits, just discrete things, because otherwise it's just this vague thing I'm supposed to be doing, I should be doing. We want to narrow that gap between what we know and what we're actually doing. Right? That's why I go and I love coaching, is seeing that happen for folks.
So you help people, you coach people into developing habits that will build up their brain health.
Yes.
Yep. Yes. Okay. Gotcha.
And that's why on Instagram, I'm at Habit Whisperer, right? I'm helping people form habits.
And your book was all about habits.
Yep.
Yeah. Thoughts Are Habits Too.
Yeah.
By Amy Lang.
Thanks for the plug.
I've read it. Everyone should get your copy now. Tell me briefly, and then I want to get back to what you're offering folks and tell them where to go to learn more about it. But the podcast is generally related to exercise and fitness. What kind of role does fitness play in the topic broadly, and then perhaps also in whatever recommendations you might give someone?
So yeah, one of the E's in Restored is to exercise regularly. And I look at 3 things: cardiovascular training, strength training, and flexibility or balance training.
Sure.
So traumatic brain injury would be something you want to avoid. And balance helps with fall prevention.
Mm-hmm.
Strength training does a whole bunch of stuff. So in addition to just being functional in nature, right, where you're able to do the things you want to do and stay independent, it also helps with insulin sensitivity. So if you're worried about developing type 2 diabetes, or if you're pre-diabetic, that plays a huge role. And then when we talk about just movement in general, right, cardiovascular health, we're talking about improving blood flow. And blood flow is how your brain gets the nutrients that it needs. So fitness definitely is really important. So a few years ago, I actually started taking tennis lessons. And one of the things I had learned, it might have actually been through Dan Ritchie and Cody Sipe with their functional aging stuff, or maybe Mark Middleton, I can't remember, but there was this talk of, when you're learning a new sport, right, learning something new, you can't help but trigger the formation of those new connections.
Yeah, right.
Right? And exercise triggers the release of BDNF, brain-derived neurotrophic factor. That's like miracle growth for your brain. So again, it's helping to facilitate that new connection. And like tennis, you're moving, so you're getting the movement in. It's cognitively, stimulating, right? Because you're having to learn new stuff, pay attention to what the other person is doing, this ball and what it's doing.
Sure.
So you're getting outside, so you're in sunshine. Vitamin D is really good for your brain. So there's all this stuff. And then on top of it, anytime you cross the midline, your brain, right now you're using both sides of your brain too. You're crossing that corpus callosum, which is also really important for brain health. So, and I'm learning something new, right? So there's all of this stuff. So I think learning new sports and cardiovascular, right? So you have to balance all of this stuff. So like learning new sports, if you take on a new sport, that can be really, really helpful as well. I just love tennis too. So I always had it in my head, like I wanted to get pretty good at tennis. I'm still not, but I'm like, I can do a slice now. I can do slice. I can serve. So these are all things like serving looked really complicated. It still is complicated, but I can kind of do it now.
Okay. Yeah. So you might recommend that someone who's not exercising begin exercising.
Yeah. And so in my book, I called it mindful movement. I think exercise, we talk about, I say thoughts are habits too now, right? Exercise, people attach all kind of meaning to exercise. And I just want the word, like, oh, I have to exercise, 30 minutes a day, blah, blah, blah. And yeah, there's all this like, in the weight loss world, it was very much of a, if I didn't need to lose weight, I wouldn't be exercising. That was something, right? Like, oh, you hear people, it's flipped around. Oh, I'm going to join a gym because I want to lose weight. As opposed to, I want to join a gym because I want to take care of my body. And I like the feeling of being strong and taking a flight of stairs and not even having to think about it, right? It's a different motivation. Yeah, so I like to say mindful movement. It just, all movement counts. Find stuff that you love doing because then it's not a chore. You don't have to do it. I get to go play tennis twice a week, at least. I'm, unless it's too hot and then I don't like it. Then I melt.
Okay. So I want to conclude by telling people where to go to learn more about what you're doing and how you can help them and answer their questions about this.
Okay. So best place to go on the web is probably moxie-club.com. That's my website. Moxie-club.com. You can follow me on Instagram at Habit Whisperer, on Facebook at, I believe it's Amy Lang Coaching.
Okay.
So I wish they were all the same, but they're not.
Okay.
And if you go to the website, you can get the protocol, the restored protocol. I also have a free masterclass that you can register for. And actually, it's like instant access. So you can watch the replay of a live masterclass.
Okay.
And yeah, that would be my gift, is it goes through what I believe you really need to understand, like the 5 keys to protecting your brain health.
All right. And I will put all of that in the show notes so people can find that, how to reach you and learn more about this. And I want to thank you, Amy, for joining me. It was good to see you again. It's been too long.
Yeah, it's good to see you. At some point, we'll have to figure out, I need to get you back on mine, actually. Yeah.
Yeah. Get me back on there, man.
We're going to figure out, like, we're going to get people to subscribe to your channel on YouTube, right? So if you like this, hit the subscribe button.
That's right. Hit the subscribe button.
Wherever it is.
Wherever it is.
Next video, wherever.
Watch the next video. Stay on YouTube. All right, Amy. Thanks again.
You're very welcome. Thank you for having me again.
Okay. Bye.
Bye.
Thank you for listening to the Optimal Aging Podcast. I'm your host, Jay Croft of PrimeFitit Content. I hope you enjoyed it, and I hope you'll subscribe, review, and tell a friend. All of that helps me grow my audience. I hope you'll share any comments you have with me, including suggestions about people I should interview and topics I should cover. You can learn more about my newsletter and content business at PrimeFitContent.com and write me at jay, at PrimeFitContent.com. And I'm on all the social channels. Again, thanks for listening. Join me next time.